My name is Jill Suter. I'm a distinguished professor of sociology and an affiliate of the Center on Aging and Life course at Purdue University. Research across the last 40 years has shown that when we're looking at childhood and adolescence, definitely mothers do favor some children over others, not intentionally. And when we look at adulthood, in our study, which has been across a period of more than 20 years, looking at the same 560 families, we find that mothers do tend to favor particular children over others, and that these patterns are very stable across this period. They're also willing to identify the children with whom they have the most conflict and the child in whom they are the most disappointed. Adult children are very certain that they are right about who is favored and disfavored in the family. But in fact, when we look at what mothers report, we find that adult children are right less than half the time. And this is across emotional closeness, disappointment, even conflict. They are remarkably poor reporters of what their mothers are really thinking. When we look at other research on childhood and adolescence, we find that perceptions of parental favoritism result in children having more hostility with their siblings and having more behavioral problems. Now, in our study, when we're looking at adulthood, what we see is when children perceive that they are favored or disfavored, they are more likely to have high levels of conflict and lower levels of closeness with their siblings. And in addition, they are likely to have higher depressive symptoms when they perceive they're favored or disfavored. We might think that favoring and disfavoring particular children would have no effect on the mothers. But interestingly, we find that mothers also have very strong sense of who they would like to have care for them if they experience disabilities or serious illnesses. And if mothers are not cared for by the children whom they, several years before, had said they would prefer as their caregivers, those mothers have higher depressive symptoms. So we do see effects on mothers as well as on the adult children.